Hello, one and all. This is Dr. Merlin, specialized in periodontology. On behalf of the Oral Awareness Program conducted by Indian Dental Association Tiruvalla branch, I am hereby to share few sights on the association between gum disease, heart, and COVID-19 infection. Have you ever wondered if there is any potential link between oral health and heart? Well then, the answer is yes. There are basically two types of gum diseases. Gingivitis, which is the mildest and most common form of gum disease, and it can be cured. Gingivitis, if left untreated, can turn into more destructive one called periodontitis. Periodontitis is the sixth most prevalent disease in the world. According to National Health and Nutrition Examination Survey, the history of heart attack increased with severity of periodontal diseases. Hence, periodontitis increases the risk of coronary heart disease, stroke, and infective endocarditis. Now, the periodontal microorganism present in dental plaque appear in the bloodstream in direct proportion to the severity and extent of periodontal infection, and these can impact distant sites. These organisms enter the bloodstream where it proliferates, initiating an inflammatory cascade leading to apoptosis and consequent endothelial dysfunction, which is associated with hypertension. The inflammation in arteries can lead to fatty deposits and results in formation of blood clots. These can block arteries and can trigger heart attack. To add on, these bacteria can infect inner lining of heart and surface of its walls, resulting in infective endocarditis. Apart from that, the fatty deposits can pass the bloodstream and enter the brain, resulting in a block. This could trigger what we call a stroke. Now, what about the effect of COVID-19? The presence of pathogenic bacteria in periodontitis patients may result in their aspiration and expose periodontal patients with COVID-19 to an increased risk of complications such as being intubated or even death. Therefore, poor oral hygiene and inhalation of periodontal bacteria may aggravate COVID-19 infection, and thus the improvement of oral health may reduce COVID-19 complications. Appropriate oral hygiene, which includes brushing and flossing twice a day and using mouth rinse, are mandatory to prevent the spread of COVID-19 as well as to minimize the risk of cardiac problems. Seeing a dentist at least every 6 months for an evaluation and cleaning is also important for long-term preventive care. I hope the information provided by IDA Tiruvalla branch would be useful. Thank you, one and all.